Good morning, and you're most welcome to our conversation today on diabetes here at the Prudential Health Webinar Series. It is my pleasure to invite you to come along with us on this conversation and discover everything you need to know about how to stay healthy and strong and how to avoid the prevalence of getting diabetes. My guest today is a consultant physician at the Department of Medicine, Kolibu Teaching Hospital. He's also the Secretary of the Ghana Medical Association, Accra Division, and also a lecturer at the Accra College of Medicine and the University of Ghana Medical School. You're most welcome, Dr. Ba.
Thank you very much.
We will go right into our conversation. Of course, the first question is naturally, what is diabetes?
Thank you very much. So, I want to just make it straight that we are talking about diabetes mellitus. I know when we say diabetes, everybody knows it is the sugar one. There are other types of diabetes, but today we are talking about diabetes mellitus, which is the sugar diabetes.
Sorry, give me a second to practice that. Diabetes mellitus.
Yes.
All right, please carry on.
Okay. So when we say somebody has diabetes, it means that the person's sugar level or the blood glucose. So for the sake of I'll just say sugar, your blood sugar levels are higher than normal. So there is a normal blood sugar level for everybody, depending on whether you've eaten before the test is done or you've not eaten before. So we have values for all of them. Now, the body has a way of controlling your blood sugar to make sure that it is within the normal range. So there is an organ in the body called the pancreas. This organ produces a hormone called insulin, and this hormone, together with the other hormones in the body, regulate our blood glucose level or our blood sugar levels. So even if you eat a heavy meal or you've taken a lot of sugar, once your pancreas is working well and is producing the hormone called insulin, that hormone will make sure that it regulates the sugar levels in your blood to make sure they are always within normal. So it will get the extra glucose or the sugar into other parts, so it may be in the liver to be stored, so that when you've not eaten, when you are fasting, it will be released into your body, into the muscles and other places. So once the insulin is not able to do its work, or some of the tissues that pick up the glucose or the sugar are not able to do well, then your blood sugar levels will go higher than normal. Then we say you've gotten diabetes. So based on that, there are let me just say two main types of diabetes for now, or let's say three main types. So we have got type 1 diabetes, then we have type 2 diabetes, then we have, let me say, the third one is other types. I will come back to that. So the type 1 usually happens in younger people, and it is because the insulin that I've talked about is not being produced at all, or not being produced in larger quantities. So it's a problem with the insulin, the production of the insulin. And when we come to the causes or the risk, we will talk about those ones. But basically, that is the one that happens mostly in younger people. If somebody who is 1 year, 2 years, 3 years can have diabetes.
Interesting.
So it can happen in children, and most of them is type 1. So for those people, when we are managing them, we have to inject them that hormone, the insulin. So you can see that they usually do injections, because for those people, tablets will not work for them. Then we have the type 2 diabetes. For those who have the type 2 diabetes, their insulin is being produced, but the insulin is not able to work well in terms of regulating the sugar, because the other organs that pick it up, or where the action is supposed to be, it doesn't happen. So although the insulin is there, it's not able to do the work. Do you get it? So for those, that's what we call the type 2. So for those ones, we can give them tablets to help the uptake of the glucose and all of that, or to get the excess glucose out of the body. Then we have some other types of diabetes. For example, we have one we call gestational diabetes. When you say gestational, it means pregnancy. There are some people who get they've not had diabetes, and when they get pregnant, their sugar levels go high. We call it gestational diabetes. For those people, we still manage them with the insulin and some of the tablets. But if it's the pregnancy that brought it up, and it's the hormones and all of that, the pregnancy hormones can predispose you. Once they deliver, then it goes away. Most of it will go away. So we call it gestational diabetes. There are some other small types that we do not have to go into those ones now.
Right. So Doc, with everything you have mentioned, I'm sure people are curious to know what the risk indicators are. What increases your likelihood of getting diabetes? How does a 1-year-old end up with diabetes?
Exactly. So if you have maybe during even the formative years in the womb, if there is any problem with the pancreas or the group of the pancreas or the cells in the pancreas that produce the insulin, then that could happen to them. Some of them also get some infections that affect the pancreas, and then they get it. But most of those who are young, they are genetic factors that predispose them to having the type 1 diabetes. A lot of genetic factors that comes into play to cause that. So that is how come those ones can have diabetes. But for the type 2, most of it is lifestyle related. For the type 2, most of it is lifestyle related. So what are some of the risk factors for the type 2? 1, obesity. So anybody who is obese has a higher risk of getting diabetes. Number 2 is sedentary lifestyle. So people who are always sitting, not active, not exercising, that could put you at risk of getting diabetes. Then alcohol consumption. Excessive alcohol consumption can put you at risk of getting diabetes. Alcohol itself can destroy the pancreas. It can cause what we call pancreatitis, chronic pancreatitis, which can make you get diabetes. It can also lead to some of the other metabolic conditions. We call them metabolic, that can increase your risk of getting diabetes. Then smoking has also been identified as one of the risk factors for diabetes. There are other ones. We've talked about the family history. So if you have a family, your parents or first degree relatives who have diabetes, there's also a risk of you getting diabetes. And there are certain medications that could also put you at risk of getting diabetes. I don't want to mention some of those names here, but let me mention one of them: steroids. So you know, a lot of people take steroids for, I'm sure when we say steroids, our people know what we are talking about. Some take them for various reasons. Some of the women, the bleaching creams, they actually contain steroids. That is what makes your skin fair. And those steroids, for example, those in the bleaching, those who bleach, there are steroids in it. So as you use it, it gets absorbed into the body. It can put you at risk of getting diabetes. Then some also take it as tablets, especially those who do the muscle building. It makes your muscles heavier and muscular. So they usually take them to make them develop big muscles. So steroids, it's not good unless a doctor prescribes them for you. It's not good to be taking them for such So for those we even give steroids in the hospital, we always monitor them to make sure their sugars are fine. Immediately we see signs, we change them for them. So those are, so there are other medications that we will not have to mention their names now.
So Doc, you've spoken about avoiding smoking, avoiding drinking, avoiding a sedentary life, and doing as much as you can in your power to prevent diabetes. So if I may ask, where does sugar come in? Because we hear our mothers saying, don't eat too much sugar, you've had enough sugar, otherwise you get diabetes. Is sugar in any way a direct cause of getting diabetes?
Okay, thank you. So like I said, the main problem is the insulin and all the peripheral cells that take up the glucose. Yes, but you see, if you continuously take a lot of sugar, what you do is you are putting a lot of pressure on your pancreas to always produce insulin. And I'm sure, like you know, any machine, even if it's a car and you use it the more frequent you use your car, the likelihood it is that it will break down earlier than the one that you don't use frequently. So yes, in that sense, we say that when you are taking a lot of sugar, it could put a lot of stress on your body. There are also a lot of ways increased sugar is not good for the body. So it's not like you shouldn't take sugar at all, but you should be able to regulate how much you take.
Okay, all right. So what are the symptoms of diabetes? For instance, is there any telling sign that lets you see, I should probably go and check this out?
Sure. So that is especially for the type 2. In fact, for most of them, there are some cardinal symptoms that will alert you. One of them is you find out that you are urinating a lot. When you go and urinate, it's a lot. Call it polyuria. And it's all because the sugar is an osmotic thing. So once it's in the blood, it draws a lot of fluid. So it makes you urinate a lot. So they go and urinate and it's plenty. So you see that you are urinating more frequently, and also when you go and urinate it's plenty. That could be a sign. Of course, diabetes is not the only thing. All the things I'm coming to talk about, diabetes is not the only thing that does that. So don't say, hey, if I'm urinating plenty, then I have diabetes. No. You still have to check. You still have to check. It doesn't mean so. Then, when that is happening, because you are urinating a lot, you get thirsty easily. You know that when you urinate plenty, you are losing fluid. So because they are urinating, they get thirsty a lot. And when they get thirsty, they drink a lot of water. So we call it polydipsia. So you see that you are drinking a lot of water. But the more you are drinking, you are also urinating a lot and get thirsty. So those are all signs. Then you also realize that you are losing weight. So most people will realize that they are losing weight, although they are eating well. In fact, it makes you also eat well because you are losing a lot of glucose. So you find out that you are eating well. So you eat a lot. But the more you eat, you find out that you are still losing weight. You are losing weight. So unexplained weight loss, despite eating well. Those are some of the signs. Some people will actually know when it is causing, what we say, when there are complications, when it has caused other problems in the body. In fact, somebody's sugar can be high for a long time, will not know. If you don't check, you won't know until it starts causing trouble. So you don't even have to wait for these things. That is why we say it is important for people to do screening at least once a year. Check. Just go to a doctor and do a full screening. And checking your sugar is a good thing to do. So those are some of the, sometimes when it has caused other complications, like for example, it can affect your eye. So you see that you can't see very well. So some people go to the eye clinic, then they say, oh, the way we are seeing, check your sugar, then you realize it's high. Then they refer you to the physician. Or sometimes you see that you have what we call peripheral neuropathy, so numbness, anansi. It is anansi, burning sensation. Then during the investigation, they find out maybe your sugar is high. For some of the men, it has affected their manhood. So it's not working well. Then when they are doing the investigation, they realize that, oh, you have diabetes. It can cause heart disease and all of that. So, but you don't have to wait to get any of those things.
So, Doc, you've spoken quite extensively about all of these things and what they can cause and some of the things that we can look out for when it comes to getting diabetes. I just wanted to ask, is it true that a low carb diet has a way of helping you prevent diabetes?
Yes, okay, thank you. Well, carbohydrates have a lot of glucose. In fact, when carbohydrates are broken down in the body, then it releases glucose or the sugar in the body. So, yes, it can help you. So most of the time when you go and see the dietitians, you know, the Ghana, our diet is heavily carbohydrate based.
Yes.
So you go and buy kenke, somebody is saying 2 balls of kenke and then some small fish and pepper, and that is it. But you see, when you go for international meeting, they make you take the starters, you take some salad and fruit first. So then your tummy is filled. So then you don't have much appetite for the carbohydrate. So it is important when you see a dietitian, they will actually give you a diet plan that has low carbohydrate. So low carbohydrate diet is actually a very good way of dieting. You have more proteins, vegetables, and the rest. So that we won't do like that. We do fufu, whole bowl, some small fish, and yeah. So yes, there is some truth in that, and it helps.
So, Doc, based on what you're saying, you would advise us to cut down on how much carbohydrates we eat versus proteins and fruits and all of that.
Yes.
Okay.
It's a healthy way. So let me tell you, when you take like a plate, let's say you are coming to have your lunch, and then the plate, imaginary, just divide the plate into 4 equal halves. One out of the 4 parts should be carbohydrate. The second part should be protein. The third part should be fruits, and then the other part should be vegetables. And so you can see that the carb should actually occupy one fourth of your plate.
That's why I laughed.
But it's usually not so in most of our homes. So we need to move towards that.
All right. Well, you heard it here first. The next time you're going to buy fried yam, make sure that your proportion of your protein is proportionate to your carbohydrates. So if you're buying 5 cedis yam, make sure that your protein is not cost that much, but it should be just as much, so that when you eat, you can ensure that you have a balanced diet and you are less likely to get diabetes. This has been very interesting. I just wanted to ask, also in the area of diet, where does honey come in? Where does sugar-free food come in? Is there, we see diet Coke. Are all those ways for us to live healthy and avoid diabetes, or is it just marketing and PR?
All right, so they all help. Like we said, we don't want to burden the body with too much glucose load, because we will be overworking our pancreas. So yes, diet Coke is okay. Low carbohydrate diet, which, as we said, it's the way to go. So anything that can help you reduce the sugar content is fine. When it comes to honey, yes, some people decide to use honey rather than the sugar. And you know, the sugar, the brown one is better than the white one. It has to do with quite a number of properties. So if you want to use it, but yes, you can also use honey or sweeteners to substitute for your sugar.
So with that, there are no limits, also in moderation.
Oh no, also in moderation. Also in moderation.
Right. So I have one last question, which I'm sure is on the mind of everybody here. Once you have been diagnosed with diabetes, what are the next steps? Is it curable? Is it treatable? Is it manageable?
So diabetes in a large part is manageable. So we manage it. If it's type 1, it is unlikely to be curable, but we manage it. Type 2, mostly we manage it, but there are only a few ones that are curable or reversible. Like I mentioned, if it's gestational, then yes, once you delivered, it will go back to normal. But even that, it puts you at risk of getting diabetes in the future. So you still have to put in the preventive measures. Largely, diabetes is manageable. We manage it. And once you visit your doctor, managing diabetes is a multidisciplinary thing. We need the doctors, the physicians, we need the nurses, we need dietitians, we need your coach, your exercise, your gym, your coach. Everybody must be on board. And once you go to your hospital, well, your doctor puts you on medications, you do your exercises, you follow your diet plan, we make sure your cholesterol is fine. Most people don't have problem. We have people, I've seen elderly people who have been taking, they've had diabetes for over 40 years and they are doing well. If you don't manage it well, then it brings what we call complications. And that can be, some of the complications can be serious. Your sugars can go high, you get confused. We have the acute complications, we have the chronic complications. It can affect the eye, call it diabetic retinopathy, and it can lead to blindness. But that is preventable. So if you have diabetes, at least once a year, you need to see an eye doctor to check your eyes for you. It can affect the kidneys. So if you have diabetes and it's not well controlled, diabetes and hypertension are the leading causes of kidney disease. So if you don't control it well, it can affect the kidneys. It can also affect the heart. You can have heart attack. If your sugars are not well controlled, you can have heart problems. You know, for men, it can also affect the manhood if you don't control it well. You get a time the thing will not be strong, you know. But once you control it well, most of the time you don't have too many problems. The other thing is, if you get a sore, you know, diabetes interferes with your immune system. It makes it a bit lower and some of the healing processes. So people get sores on their toes, and if you don't treat it well, it becomes a big thing. And if you don't take care, amputation. So diabetes has led to a lot of people losing their limbs just because of all of this. So it is important that we take the management serious. If you manage it well, you can live all your life without much problems.
Doc, this has been most enlightening. I, for one, have taken one thing away, which is to make sure that every time I pick up a plate, I have to divide it into 4 and make sure that I fit my carbohydrates into 1/4 of it. Before this, I'm sorry to say, it wasn't that at all.
It's not only you.
It wasn't that at all. So that's definitely a takeaway for me. And I hope that you also who have tuned in have gotten quite a number of takeaways to go with. As much as possible, if we have not answered any of your questions, this is the time for you to put those in the comment section. So once again, would like to thank you for tuning in. Please share this content on whichever social media platform you're watching it from, so that others can also benefit from this enlightenment. And of course, please stay healthy. We care about you. Thank you. Until next time.